Place yourself in the shoes of a 65-year-old woman. She has diabetes, she's taking medications for high blood pressure, and she has back pain from a recent fall, and she also just found out that she has cancer. Is she getting the solution that she needs from all these medications, or is the doctor just prescribing them to her for a short-term solution? What are her alternatives and the long-term effects of taking all these medications? And what happens if she chooses to adjust the medication by increasing it or decreasing it? Views are deeply polarized on prescription medications' impact on American citizens. Doctors, patients, pharmacies all have their own different views on how this affects us as American citizens. The three main controversies that I will be discussing today are the views on medication, the solutions, the alternatives, and long-term effects, and adjusting without authorization. First, doctors and patients have different views on the purpose of taking medications. This is what they have to say about receiving and contributing to the medications. Dr. Angela Coulter said that 1 in 5 people take at least 5 medications per day. People go to the doctor seeking for a solution to help them, but they don't think twice to question the doctors because they are so highly qualified. And the doctors only prescribe the medications for short-term benefit, leading us into this opposing views. Colleen Fernandez said that 1,900 prescriptions are written per minute across the world. Doctors are scared to take their patients off of the medications or to deny them medications because they don't want to be blamed for the psychological impact, withdrawal effects, and even the extended medical impacts. Leading us into my second inherent issue, our bodies can only take so much of the medication that we're prescribed. So what are our alternatives and our long-term effects? We do have alternatives. Integrative medicine seeks to restore and maintain health and wellness across a person's lifespan by understanding unique circumstances and addressing full range of physical, emotional, mental, social, spiritual, and environmental influences that affect a person's health. That's what the staff at Duke Integrative Medicine said. On the opposing side, organ damage and failure, tolerance to the medications, psychological addiction cravings, withdrawal, increased mental health, paranoia and depression, decreased cognitive function. STAT is what the staff at Merwood Teen said, and they are an addiction center in North California. The doctors aren't prescribing this medication for the patients to be on them for the rest of their lives. Lastly, there are pros and cons of the patients taking or stopping the medication abruptly. Regulations are in place to assure that the patients do not get more than what they are supposed to be taking. Patients still opt to alter their medication, but the pharmacy keeps sharp records of when they are allowed to refill the medication or not refill it. They are also not allowed to refill their medication without the doctor's credentials, being a prescription handed to you to give to the pharmacy or given on the prescription label. On the opposing side, Dr. Coulter says that it is easy to begin taking medication, but stopping is more tricky. With that being said, altering medication may cause the medication to stop working completely. Drugabuse.gov said that in 2013, 6.5 million Americans 12 and older had used prescription drugs non-medically in the past month, thus causing patients or people, because they're not really prescribed medication, to want to take more, be addicted to the medication. In conclusion, let's return to the 65-year-old woman. She's taken countless medications in hope for a solution that the doctor is only giving the medication to her for a short term. Is her body still strong enough to intake all the medication, or should she find an alternative? But if the medication is helping her, why should she find the alternative? And when the day arrives that the medicine has stopped working, or she is becomes annoyed by it, if she increases or decreases the dosage, what is going to happen? You can clearly identify that American citizens can both find relief and annoyance from taking prescription medications, but where do we draw the line with knowing the purpose, our body intake, and altering the amount of medication that we take? Thank you. Any questions?
Where's all this money going for prescriptions, for doctors? Is there any part of your research that talked about the?
I did not look into like when the health system pays for the prescriptions, or the people pay out of pocket for the prescriptions. I did not see where the money goes to. Just being a citizen, obviously, your insurance is going to pay for your doctor's visit and either have full pay or copay on your medicine. So I'm not sure in the pharmacies if it's going towards the actual medication or paying the the pharmacy workers.
And let me rephrase the question. Do you think that medicines are being prescribed for monetary gain? Like for the doctor's monetary gain, or for the pharmaceutical company's monetary gain, not the benefit of average Americans?
Personally, I think that the doctors prescribe the medication to say that, hey, I found something that's wrong with this person. It's increasing their rates, per se, of diagnosing the patients. I don't really think the pharmacy is gaining anything because they're not the ones prescribing the medicine. Yeah.
Why isn't anybody like arguing, or like I don't know how to rephrase this, but why isn't anybody fighting to say that they should be prescribing more medications for the long-term effect?
I didn't really look into that. Medicine, you're given an antibiotic for a short-term benefit to get rid of the bacteria that's in your system, whereas being on a opiate, you are not supposed to be taking that for the rest of your life, because then you'll become addicted to it and you want to continue to take more of it. Does that make sense?
All right.